Friends, welcome back to Yoga for Dentists. I'm your host, Dr. Josie DeVideo, longtime dentist and certified yoga teacher. And today I have the privilege of chatting with Dr. Josh Austin, who is a dentist in Texas. In addition to being a published author, he is a nationally recognized lecturer on restorative dentistry. He also has a monthly column in Dental Economics magazine that focuses on guiding dentists in their decisions about dental products and equipment, but he is also a well-known co-host of the Working Interferences podcast. So, Dr. Austin, welcome to the show.
Good day, Josie. I'm thrilled to be here.
So, I wanted to have you on because I saw your presentation at the Voices of Dentistry conference in January of 2020, where you gave your presentation called Chamfered Psyche. And I know you've done that presentation in a few different venues, which is awesome. I feel like every meeting person should have you there to do that presentation. And so for my listeners who maybe are not familiar with you or haven't heard that presentation, if you can give us a little summary of it, and that way we can get into talking about the meaty details.
Absolutely. Well, thank you so much. I remember that meeting fondly because I think probably the last real meeting that I went to before everything shut down. So VOD 2020 will always have a place in
Yeah.
my heart because it was the last place and the last time I got to see a lot of my friends in person. So I had an incident happen last year, and I don't think the details are all that pertinent, but many of us have these sort of moments in our life where we realize that there's things about ourselves that we don't like. And something happened with me that I realized that there were some things about myself that I didn't like, and I wanted to improve them. And I tried to figure out the best way how to do that. And I really figured out that sometimes you need a professional to help you with things. And for me, that profession was a psychotherapist. And so I started seeing a therapist consistently around, I guess September of last year. And that therapist has made huge impacts on my life. And I've kind of transitioned through different modes of therapy over that time and have, had several different experiences. And I feel like it's helped me enough. And from reading some statistics about sort of where other dentists are at in this, in kind of in a framework of how they feel about themselves on a day-to-day basis and how they struggle with stress and different things, that I feel like a lot of dentists could use this. And it's something that I don't hear many people talking about. And so I just felt like sharing my journey with it would be something that, maybe somebody out there could get some benefit from. And so that's really kind of the whole deal, is that, hey, it's absolutely okay. This job's really hard. And if you need to see a therapist, do it, and don't think twice about it, and don't be embarrassed about it. Like it's part of becoming a better person.
Absolutely. I mean, I was doing a little bit of research to prep for our time today. And, there is an ADA study from 2015 that says that 11% of dentists are diagnosed with either depression, 6% are diagnosed with anxiety disorders, panic attacks,
Yeah.
but only
And
28
those are
Go
all
ahead.
self-reported studies.
Right.
So people are always going to underreport on those things, right? So
Yes.
if you have that kind of percentage, and so if you talk about major depressive disorder, right? Like that's there was big systematic reviews and meta-analysis that showed that like 9% of the world's population has major depressive disorder. And so if the ADA is showing 10% of dentists self-reported have it, then it's an even higher number than that. So
Yeah.
what you're seeing is that like this affects dentists more than it would affect maybe some other professions.
I mean, I feel like I had to read that again because it really should have said 10% of dentists don't have any anxiety
Right. Yeah,
disorders or
exactly.
depression.
Exactly.
And then as I was reading further, it said that, 28 of those people who said or admitted that they have an issue, only 28% sought help,
Yeah.
and 44% think that they can solve their own problems and don't need to talk to anybody
Right.
about anything.
Right.
Which, if you spend any time on any dental Facebook group,
It's 100% true. It's the exact
that,
personality of dentists.
I mean, come on.
Yeah.
So I really appreciated your presentation because not only were you shedding light on something that we need to talk about, but you were also very vulnerable in sharing your story. And like you said, there's no shame in that. If anything, it shows your strength of character and the confidence that you have in yourself to be like, hey, this is who I am and this is what I'm dealing with. And if me being brave enough to share it helps someone else out there, then I'm going to do it. So kudos to you
Well, I
for doing
appreciate
that.
that. It's you know what, I'm not into transcendental meditation. That's not kind of one of my deals, but my mentor is a guy named Bill Robbins, who's a really amazing restorative dentist, and his mentor was into transcendental meditation, and so Bill's kind of been through the whole deal, and he has like a mantra that he chants in his head. He has all of that stuff, right? And so I don't have like a mantra, but I do kind of like I try to come up with sort of just single words that I try to think about, like I would say core values, right? And one of my
Right.
core values that I've really tried to focus on over the last couple of years is authenticity. Is just trying to always be authentic, because there's so many people out there on the dental lecture circuit who are really inauthentic, and they have their persona that they are on stage, and then off stage and in their practice they're completely different people. And so much so that like there's this one dentist who practices in California, and I don't want to say his name, but many people would recognize his name if I said it. And I was in his course one time, and somebody asked him about post-op sensitivity, right? And he just said like, "Oh, I never get it. It's not a problem in my practice." It's, wow, that's awesome, really cool. So happened to be in his city, and I had like an extra half a day. And so I called and asked if I could come hang out and watch. And like in the half a day that I was there, he had 3 patients in for post-op sensitivity. And
Of
it was just
course.
like, okay, so I mean, it's just BS in and BS out. And I just was immediately like, that kind of taught me a lesson of, it's easy to get up on stage and say something because there's no one there, there's no one there to follow up on it. And I just, there are certain people that are very authentic, and I want to be amongst those. And that's kind of where this is coming from. And I'll admit, like, my IQ on this kind of stuff is still not great. Like, I don't have a huge amount of experience, but I can share my journey and share my story. And where my journey started was I didn't even know like where to go, like how to find. I didn't know like what type of therapist I needed. I didn't know like I needed therapy. Like I thought I needed a psychiatrist because that's like what I had seen on the movies, right?
Right.
And so I like made an appointment with a psychiatrist. Like, went to the psychiatrist. We had 2 sessions, and she was very nice. And about halfway through the second session, she said, "I've talked to you now for about an hour and a half total, and you don't need me." And I was like, "Well, what do you mean? I don't like, I thought this is just what it is. Like, I just come in and talk to you like every other week or whatever." And she's like, "Let me put it in a way that you can understand it." She said, "I'm a psychiatrist. So I'm like you. I'm the dentist. I treat active disease, right? So somebody has an active panic disorder, somebody has borderline personality disorder, things like that that need to be managed medically. I'm the one who sort of quarterbacks that care, works with neurologists and works with psychotherapists and does the things." She said, "You need a therapist. A therapist is like a dental hygienist. Like, when I go see you, I may see you for an examination every year, but most of my work is done with the dental hygienist," right? It's like, yeah. And so that's really kind of what helped me sort of figure this out, was that the vast majority of people need a psychotherapist. You probably don't need a psychiatrist unless you have some other, disorders going on. But a therapist can help pretty much anybody the same way a hygienist can help pretty much anybody, right? And so that's kind of what we've been working on. And so the same way that like your hygienist would go over oral hygiene instructions and sort of, information and teaching, our patients skills on how to maintain good oral health, a therapist teaches you skills on, coping skills on how to
Right.
maintain good mental health, right? And so and good mental hygiene, right? And so that's kind of the way to think about it. And so that's kind of where my journey started, was with a psychiatrist, because I didn't know like that's not where you were supposed to start, right? And she's like, "I appreciate you coming here, and this is great." And so then she referred me to her therapist, and her therapist and I didn't really mesh. Like, we didn't have a great connection. And so then I sort of went on this journey to find a great therapist, or to find a therapist that I meshed well with. And so then that's sort of the next phase of the Shamford Psyche story.
I think that's an important distinction to make because you can find a therapist and then after a while realize I'm not really like enjoying this person. They're not helping me.
Yeah.
Because all right, at the risk of getting a flood of emails for saying this, therapists are a lot like dentists. Like there are good ones and there are not good ones.
Right.
Like
Well, and there's also like good for you, like what
right.
may be good for you may not be good for me and vice versa, right?
Absolutely.
So
Uh,
that's
uh,
a big part. You got to click with your therapist. There
you
has to
have
be
to.
like a two-way exchange. You have to feel comfortable because if you're not comfortable, you're not going to get to where you need to get.
And if you're not comfortable, you can't be completely honest.
Right.
Um, the other thing, the flip side is, for example, I have a therapist that I've been seeing for a couple years now, on and off. I go like maybe once a month now. And it's gotten to the point where she knows so much about me that I'm now starting to think like, I don't think she can help me anymore because she knows too much about me.
Yeah.
So maybe
So as
it's
well,
time to
certainly, and it's
switch it
like,
up.
you know, therapists have their skill sets, right? So it's just not unlike dentists where it's like, I'm not good at endo, right? So I don't really do any of it. And
Right.
so it's just like, if anything like looks vaguely endodontic, it's like, send it to endo. Like, I don't even want to deal with it, right?
Right.
And so, that probably means that I miss some other stuff that's endodontically related because I just am not good at it and I don't look for it. And whereas other people do a lot of endo in their practice, and so they probably diagnose a lot more endo than I do. And so I think that's probably the same way with therapists. Like some therapists have a skill set in a certain way. The current therapist that I'm working with really works a lot with something called EMDR. Have you ever heard of EMDR?
I've not only have I heard of it, I've done it.
Okay, so
Yeah.
some people love it, and some people don't like it so much. I'm sort of in the middle with it. My therapist, if I had to find a fault with her, she thinks everything can, or she thinks that EMDR is an incredibly effective tool for almost anything. And I'm not 100% convinced of that yet, but I'm kind of
Right.
going along with it because I like her and I like sort of where we've gotten. But she does like to go through EMDR. But there's like lots of other things. There's lots of other, types of therapy
Right.
that can be done. And sometimes you may need this and sometimes you may need that. And so
Right.
it's not uncommon to transition through therapists over time. I would say I don't think it's probably all that healthy to have the same therapist for like 20 years. I
Right.
just don't think that that's probably, good or that's probably not enough. Right. So
And
it's
for
very
our
important.
listeners who are not familiar with EMDR,
Yeah.
EMDR is a type of like almost like a physical therapy where you're focusing on memories or images and the therapist is like either moving their finger back and forth. They're kind of
Yeah.
simulating this rapid eye movement
Yeah.
and somehow that magically fixes something in here.
It stands for eye movement desensitization and reprocessing. And so I've only ever done it virtually. I've only ever done it over like a secure Skype session. I've never done it in person. In person, they have like a light board with like a light that follows around, and you just follow the light with your eyes. On virtual, she sends me to this web page that has this ball that moves across the screen, but it's the same idea. And so you follow whatever is moving with your eyes. And I know this sounds kind of hokey
I
to
know it does
anybody
sound
and the
totally
first time
weird.
I saw it, I was like, what? This is weird. And then it's specifically made to help you process painful memories, past traumas, right? And there's two kinds of traumas, and we can talk about this. There's capital T trauma,
Right.
a death of a loved one, divorce, being laid off from a job, those types of things. And there's like little T traumas. I always relate it to like think of the most embarrassing moment, like the most cringeworthy moments of your life, and it's always like, I had toilet paper on my shoe at some party. No
Right.
one else in the world remembers that, but you remember it
Right.
so vividly because it's a little T trauma. It's been imprinted on your brain. And so our brain traps these painful memories in certain ways. Along with that is every time you think of it, you have this similar cascade of chemicals that happen in your head as you process that memory. And so
Yes.
what EMDR does is try to break that cycle so that when you think of the painful memory, you don't have that same negative cascade of chemical events that happens in your brain, and you kind of refile that memory in a different way so that it doesn't bring on this, uptake of whatever that makes your brain feel crappy, right? So it's a way of dealing with traumas, is what EMDR is. And it's, I don't know, like I'm kind of a sciencey sort of guy. And so the initial thought of it is just like super kind of new agey and like, all right, well, this is just like, this should happen in Sedona, Arizona, right?
Yeah.
Like, this is what this feels like. Um, but it actually seems to work. We've worked on the same memory for like 4 sessions now.
Yeah.
And it's a weird thing, but like every time we do it, some other little nugget comes out that identifies like another little piece of the puzzle, that I
Right.
didn't even think was related. And then she like puts these pieces together and starts seeing these patterns, right? And so those are the kind of things that emerge from something like EMDR.
Yeah, in fact, if you're listening to this and it sounds interesting, you really should check it out because it reminds me of, we have a lot of colleagues who talk about they can vividly remember dental school memories of like what an instructor said to them or something that happened, and you and I are talking really about like memories even from before that.
Yeah.
But I think a lot of dentists would benefit even from processing these traumatic experiences from dental school. So it's worth looking into.
From
There are
dental school, I
costs that
mean,
can
I
be,
still remember like procedures in my practice that didn't go
right.
super well, like vividly. Like I can remember the shape of that premolar,
Right.
that I didn't prep very well, or whatever. I can
And it
remember.
conjures up those feelings, that's the problem.
Absolutely. That's yeah. It causes this cascade of neurochemical events in your brain that's not that doesn't make us feel good, and
Right.
that's those aren't great things for us to have in our brain. It doesn't we don't have to. There's no such thing as a perfect life,
No.
and obviously like everybody's gonna have some traumas, right? And those are all part of like what makes us up as humans, but not spiraling into these negative and these negative thoughts and fear cycles when you think of those things is kind of the key, right? To sort of, as therapists call it, mentalizing. Like we need to be able to mentalize these things that happen to us, and that gets really hard to do without the help of a therapist.
Absolutely, and I think that's a lot of what leads to burnout in dentistry too, is that we don't have time to process the feelings of what we're doing, and there are always feelings, and every day they get stacked on top of each other more and more, so even if EMDR doesn't sound, like it's your cup of tea, at least talking to someone and dealing with some of these emotions can only help you in your career longevity.
Yeah, and there's a couple things that kind of go along with it. Is like where we get home and there's like nothing left in the energy tank, and a loved one says to us something to the effect of, you leave everything at the office, basically meaning like all of your energy is left there, and then when you get home, there's nothing left for me, right?
Right.
And that's a cutting statement, and it makes us feel really bad because it's a lot of times it's true, and so that was part of the other thing that I wanted to get involved in therapy for was like I don't want to feel like that. I don't want to go home with zero in my tank and leave nothing for my wife, and when you improve your sort of mental health and mental hygiene, it improves your relationships not only at work, and it makes you more productive, it makes you a more effective leader, it makes your day go better, it makes your relationships better in all aspects of your life. So the most important part, being at home and whatnot. And so that's if nothing else, like even if you're Frank Spear, who has a perfect practice, or and is a perfect dentist and has never made a mistake, um there's probably still some relationship stuff at home you could probably work on, so
Sure.
I joke around and say like I don't think everyone needs therapy. I just think every dentist needs therapy. And I think that I sort of say that jokingly, but it certainly seems like there's a personality type that gets drawn into dentistry, right?
Yes.
And we like to fix things, and we like to make problems go away, and we like to make people happy, and those are all things that are getting harder to do every day in our offices,
Yes.
and we most of us wear that home. And then like my podcast partner Lance Timmerman, he's this tough gruff like I just nothing gets to me anymore, I don't care, I leave all my problems at the office, and I can't care more about someone's teeth than they do, and
Right.
he's just he has this he ran out of F's 15 years ago is what he says. But like the he most dentists just aren't like that.
No.
We carry it with us. It goes on our back, and we carry it home, and it inhibits our relationships with our loved ones, and that sucks.
Yeah.
That really sucks.
I want to take a second to go back to something you said earlier on in the show about authenticity. Do you think there's a link with perfectionism and burnout? Because in order to have that kind of personality, like if you're going to be presenting, lecturing around, you want to have this persona, this image, and now with
Yeah.
social media added on to everything, in addition to carrying the weight of all the emotional stuff that happens daily in practice, when you are a dental celebrity,
Yeah.
there's got to be that added level of perfectionism because you're presenting yourself in a certain way. So, do you think, well, let's go back a second. A couple years ago, you wrote an article for, I think it was for Dental Hacks,
Yeah.
right? About the dental
Dentalhacks.com.
porn.
Yeah. So
Okay.
I tell people, I still think today it's the best thing I've ever written. And it was
Yeah.
called Porn for Your Practice, which, like, in retrospect, I probably shouldn't have named the best thing I ever wrote. I shouldn't have put pornography in the name of it. It has nothing to do with like what you're thinking of pornography. It has to do with this sort of idea that we run into in dental social media all the time of these dental influencers, quote unquote,
Right.
who present on their Instagram feed or their Facebook feed that they have this perfect practice and perfect life. And as the rest of us, as anyone, as any human scrolls through that, we're looking at that beautiful full mouth rehabilitation that gets posted. And we think about like the class 2 composite we just did on number 18 and how we didn't do that all that well. Right. And it's
Right.
look how much better this person is than me. And you get that hit, and then you scroll to the next thing and you get that same hit again. And so what I call it's like flexing. There's two muscles that we have, right? We have a left arm and a right arm. And one arm is I'm not good enough, and one arm is I am good enough. And every time you see that thing that makes you not feel good enough, you flex that. You do a bicep curl with that. And so that arm gets stronger. Well, that's one rep that your I am good enough muscle doesn't do. And so it starts to atrophy. And then, social media can just sort of send us into this sort of spiral of thinking that we're not good enough, that our practice isn't good enough. We don't get to do full mouth cases all the time. So obviously, like, we don't have the skills to present the treatment plans and get patients to say yes. Or we don't attract patients that have the money to do these things. And even if we did, we don't have the skills to do it. And even if we did do it, and the times that we do get those cases, maybe they don't turn out 100% perfect. And then we carry that on and carry it home. And it next thing you know, we feel completely inferior to some of these people. And then what you start to realize once you start to get to know some of these people who are like influencers is their practices are just like ours.
Right.
On Monday morning, first thing in the morning, 8 a.m., they do an MO class 2 on number 3. Like, that's what they do, and it's like what you're seeing is a very carefully curated
Right.
aspect of their life. And you're just not seeing all the stuff, and you're seeing all of your stuff, right?
Right.
So you're seeing their highlight reel and you're seeing
Right.
everything that you do. And just knowing that, like, hey, it's nobody's life is like that, right? And so that's where authenticity comes into play, is like these people feel like they have to have this perfect image, right? And it's just so maddening. Some of my best friends I've met, Lance Timmerman, Alan Mead, Don Kulingowski, like, great, honest, great people that I've met. But like, for every one of you guys, there's like 150 other who are just like egotistical windbags, right? And it's just like, can we just put all that garbage aside,
Yeah.
and quit this posing, and this like flexing? One of my favorite Instagram accounts is called Influencers in the Wild. Have you ever seen that?
No.
It's an amazing account. So, it's these people line up all these pictures, these influencers of like, they're in a bathing suit and like the sun looks just like perfect off their butt, whatever. And
Right.
it's like the picture is always taken like down and to the left.
Right.
And it's a picture of like the person taking the picture, and they're like laying on the floor, like laying backwards, or like, and it's just ridiculous. And you just
Right.
look at it and it's just like, this is what our world is now, right?
Right.
It's just like it's a good look behind like the curtain,
What really
that
goes
the
on?
wizard, right? And so I get frustrated with all of that. And the other thing I loved, this is a quick aside, all the shaming of being productive during the pandemic.
Oh, yeah.
There's like all these people like, now's the time to make a move and like really like put together who you are and whatever, work on that book, write that screenplay, whatever, all that garbage. And so it kind of shamed people who are just like trying to deal with the day to day of this
Right.
like life changing monumental time, and the stress of like, how are we going to pay for our employee? Like all that, like, I'm sorry, I'm not going to write that movie screenplay because I'm trying to figure out how I'm going to pay my employees for the next 6 weeks.
Right. Yeah.
But the one thing I did do is try to figure out like what my triggers were, what my emotional triggers were. And actually I put a pen to paper to write them down. And one of my emotional triggers is social media. And so what I've learned is that when I'm starting to feel that way, when that I'm not good enough muscle is getting really toned and the I am good enough muscle is really atrophied, I take a social media vacation. And so I'll
Yeah.
just like I'll just deactivate my accounts. And sometimes it's a week, sometimes it's 2 weeks, somewhere in there. I try to do like 3 to 4 weeks a year of
Yeah.
social media vacation and just get off of it. And it's actually surprisingly nice. And
It's
one thing,
awesome. I've
it's great.
noticed that you've been missing from time to time, and for a
Yeah.
second I panic, and I'm like, "What happened to
No,
Josh?"
I didn't block anybody. I promise you I didn't block you. It's just that I'm just gone for a little bit. And there's a couple things you realize. Number one is how many times you pull your phone like out of your pocket or your purse for no
Mhm.
reason whatsoever.
Right.
Just like standing in line, even like walking through the grocery store, walking around at the mall, whatever. No reason at all. You just pull your phone out
Yeah.
because it's a crutch.
Yes.
So you learn that and you learn like, all right, well, wait a second. If I'm not looking at that, what am I going to look at?
Right.
And then you put it away. And then like after a few days, that starts to go away and you realize like how less often you pick up your phone,
Yeah. You
which
are
I think is
addicted.
great. The other thing is how much more engaged in like a conversation I am when I don't have that. Like I don't have an alert going off on my
Yes.
phone. I don't have the buzz. I don't have like the screen light up. It's like quiet and nice. I don't know. It's just
You
good.
know, in my area, there are a lot of older dentists still. I mean, they're still practicing. They're in their 70s. And I look at them and I think, why in the world are you still practicing? Like, shouldn't you be, golfing
Yeah.
and traveling and whatever? And when I talk to them, they all say, like, I just love it. I can't imagine not doing dentistry. And they're serious, like they're not just blowing smoke. And I think that's because you don't have social media. Like, you didn't grow
Yeah.
up with this thing.
Right.
Because I've noticed that a lot of younger dentists coming up now, because I do have the privilege of mentoring people from time to time, but they're very influenced by the social media. And
Yeah.
it does seem like younger dentists are not lasting in our field as long. Everyone seems to
Yeah.
be finding a side hustle, something
Right. It's
related to
all about the side. It's
dentistry.
all about being trapped in the operatory and trying to get out of it.
Yes.
Like
And
you got
so,
into $400,000 of debt to get into the operatory. Like why are you in such a rush to get out of it?
right. And I think it's because of the messaging you get from social media of
Yeah.
like, you don't have you've already been out of school for a year and you don't have 5 practices that
Yeah,
are
you don't have a
running.
prime scan and a CBCT and
Right. And so they think,
yeah.
well, I'm not measuring up. I must
Right.
not be cut out for this. So maybe
Yeah.
I'll take my training and do something else. So I do think it's been both a blessing and a curse. I do spend a lot of time on social media. I do enjoy my interaction with the people in the community, but it's also something I really can't stand. And so I
Yeah.
have to negotiate that for
Yeah,
myself as
we
well.
need to curate ourselves a little bit better. It's like I have a stupid group called Funny Stuff for Dentists and Dental Team Members. And I've gotten way less active on it over the last like year, even as like a moderator of the group, just because it's like there's just a bunch of stuff on there I just don't even like want any part of. And there's other people that like obviously they're on it all day, every day. And like if it helps get them through the day, like that's fine. But for me, I just find that it just, I honestly think that, in 50 years or 100 years or whenever we have enough time to accurately reflect on sort of what we've built for ourselves, I'm not 100% sure that we're going to think that it was a good thing. I just
Right.
think about
Right.
like where we are in society now, and I just don't know. Like there's certainly good things that have come out of it, but all in all, it just seems like things are worse now than they were. Now, certainly,
Yeah.
like people are having their eyes open to systemic racism and issues that maybe you could have avoided before by choosing what media you absorb or whatever, or what media you consume, and now sort of you can't avoid that as much,
Right.
and that's certainly great. And I those are all great things, but at what cost? And so I certainly applaud social media for some of the things that it does that way. But also, man, it's just it seems like it hurts a lot of dentists more than it helps.
Yeah. I think we're particularly vulnerable. Like you said, there's a certain personality type that goes into dentistry to begin with.
Yeah.
Then you add all the pressure and all the, the common thing that you hear that everybody hates the dentist.
Yeah.
And then
Every day, multiple times a day.
now, it used to be that you had camaraderie in dentistry, but now you have competition because of the
Yeah.
social media.
Right.
And so it just makes everything exponentially worse. But if you're aware of it, and if you can take a step back, take a break like you're doing, talk to a mental health professional to sort through some of these things, I think it can actually, um, help be helpful to you
Yeah.
in some ways if you're mindful of how you're spending your time.
Yeah. It's, you use the term mindful, and so I never ever thought, I know this is a yoga and dentist podcast. I never thought I would do yoga. Like if you would have asked me 3 years ago, I would just been like it's just something I'll never do. And I was speaking at Greater New York Dental Meeting last year, and it was one of those deals where you're there. It's one of those like long meetings. It's like 5 days, and so get there Friday and like then leave Tuesday, and like by Monday, my back was just kind of on fire, like lower back. I couldn't move. And by the time I got off the plane Tuesday night, my wife picked me up from the airport and she was like, "You don't like something's wrong. What's happening?" I was like, I can barely move." And so I noticed that like this was the worst it had happened, but like I had had some like soft tissue flare ups in my back that had created some pain. And I noticed like days that I hurt, I was a much worse person to be around. Like I snapped at my team. It just like I just wasn't a pleasant person to be around because you're in pain.
Yeah.
And so my wife actually gave me her appointment at her physical therapist. She's a dentist as well. And so Sarah is the name of my physical therapist. And she saw me and she's like, "Yeah, like you're all kinked up." So she got me kind of unwound a little bit. And so we started doing physical therapy, and I was going like once a week for a few weeks. And at some point, she's also a yoga teacher. And she said, like your hamstrings are ridiculously tight. Your calves are ridiculously tight. Yoga would really help you keep your core strong so that you don't like get all out of shape like this. And so I was like, yeah, whatever. And so after like the third or fourth time she said it, like, all right. So she's like, "Listen, I have this class. It's Wednesday nights. It's mainly older people. So we keep it pretty basic. And it's Ashtanga yoga. So
Hmm.
it's not like hot yoga. It's not anything like that. It's pretty basic. It's all the same kind of moves, like sun salutation A, sun salutation B. So you can kind of learn it.
Right.
And so I started going. And so what I started noticing was like she would tailor some of the stuff that was very specific, like hamstring and calf. And so at some point, Andrea said, "Do you not realize like when you go to yoga, she's doing things that are specifically benefiting you?" I was like, "Wow, okay. I never thought about it." But also, like, I'm sure there was other of her PT patients in there that probably had the same issues. But I started feeling better, and I started like having less and less and less pain. And so I started doing it, I don't know, like not super consistently, once or twice a week, and got stronger and got better. And then COVID hit, I like she did a lot of virtual yoga, and I wasn't to the point where I could be unmonitored. You know what I mean? So I didn't do much, but like Peloton has these 10-20 minute like sun salutations that I would do. Because I felt pretty comfortable in those. Like those are all
Mhm.
fairly easy poses and done in a certain succession. And so I
Right.
wasn't thinking so much about the movement, and I could focus more on the breathing. And now she's finally started up. We did our first live yoga class again last week. So we're sort of doing it out in the parking lot of her yoga studio.
Right.
So we're all kind of out, spaced out, and there's ants crawling across your yoga mat and stuff like that. It's,
Yes.
it's kind of a mess. But it really does make a huge impact on how I feel the next week. And that's just a huge part of it. Like if you're in pain, your stress levels are going to go up. The way you react to things is going to be way different. It's also, there's two components to it. It's the mental component in working with a therapist, and it's the physical component in taking care of your body. And the longer that I do dentistry, and I think you're probably, I mean, obviously along the same line, is I realize that this is kind of it's kind of a sport. It's kind of a
Yeah.
performance athletic endurance event. And if you don't treat your body like an athlete would treat their body, like you're just setting yourself up for problems. And so
Yes.
I see the physical therapist every month. the physical therapist is like expanding her deal. So now she has, she still has the yoga. Now she's added an athletic trainer and a weight trainer into her program. And so the two of them get together and make a athletic plan that's in like based on what her assessments are as a physical therapist.
That's
And then there's
awesome.
the yoga on top of it. So it's just this whole sort of all-inclusive suite that sort of helps me keep my body together. But like if your body's not right, like your mind can't be right. If your mind's
Right.
not right, your body can't be right. Like it all works together. And so, none of this other stuff's going to turn around until you get that physical stuff under control. And it's just all works together. So I wouldn't be kind of where I'm at now if it wasn't for my therapist, Holly, and my physical therapist and yoga teacher, Sarah. Like and they've never met. They don't know each other. I've never talked about one to the other or whatever, but they're both like incredibly vital parts of my team. And so you have to start kind of building your team that way. And we think about our team, we think about, all right, our office manager and our dental assistant or hygienist and like an attorney and a
Right.
accountant or whatever. But like I value my therapist and my physical therapist and yoga teacher as much as I value my accountant. They're just
Absolutely.
as critical to my success.
Absolutely. And I appreciate you sharing that because that's part of my message with Yoga for Dentists is that you have to meet yourself where you're at and give yourself what you're needing. And sometimes it's a dental coach, but sometimes it's usually for us, especially as we get older, personal health coaches to
Yeah.
help undo what dentistry has been doing to us. Because you're right, it is a mind body connection.
Yeah.
Josh, thank you so much for
Thank
coming
you.
on to the show today.
It was fun.
Friends, if you're struggling, we encourage you to reach out to a mental health professional, ideally, and minimally to your friends or loved ones. This is your life. You deserve more than to go through it feeling terribly. Make whatever changes you need to make to preserve your sanity. That might mean unfollowing certain people or groups on social media. It might mean removing yourself from toxic relationships in real life. It might mean carving out time for self care and taking it seriously. Whatever it takes, know that you are worth it. You have worked hard and you deserve to enjoy the fruits of your labor. Friends, to get more of Dr. Joshua Austin, listen to his podcast, Working Interferences, available on your favorite podcast listening app, or you can connect with him on his website, austindentalseminars.com. And he also hangs out with us in the Yoga for Dentists private Facebook group because he's cool like that.
Totally cool.
So thank you all for joining us today, and we'll see you there.
Awesome. That was fun.